Cardiff tests were developed here at Cardiff University. They're designed along rigorous scientific principles and manufactured to a very high level of precision. The distributor and the manufacturer are appointed by Cardiff University, and the university maintains stringent control of production quality. The Cardiff tests are designed to measure vision in young children and adults who can't communicate in the usual way. People who can't take part in what we think of as a standard eye test. That includes very young children, children and adults with intellectual disabilities, adults who've suffered a stroke, and adults with dementia. Let's talk about what it is we want to measure and the importance of measuring it. First of all, visual acuity. Visual acuity is detail vision, a measure of the smallest detail that we're able to see. With able adults, we usually measure it with the letter chart, and the most familiar one is this. We call it the Snellen chart. If I want to measure how good your vision is, I simply ask you to read the letters as they get smaller down the chart, and I record the smallest line of letters that you're able to read. An adult with good sight would be able to read the lines towards the bottom of the chart. But if you had poor vision, you may only be able to read the very large letters. Another important aspect of vision is contrast sensitivity. This is the ability to see large but faint targets. It is contrast sensitivity rather than visual acuity that is important in daily living, particularly mobility, that is, getting out and about. When contrast is good, finding objects against a background is straightforward. But when contrast is poor, objects against a similar colour background or a similar brightness background are very difficult to see. So measuring contrast sensitivity is an important part of describing a person's vision, especially if that person has a visual impairment. So let's look how we can measure visual acuity and contrast sensitivity in our special groups of patients. In the Cardiff Acuity Test, we use pictures that are familiar and hopefully interesting to our patients. In the children's version, we have a fish, a house, and so on. In the adult version, we have adult appropriate pictures. In this case, an aeroplane, a cup of tea, and so on. Each of the pictures is made up of a black and white outline. The average brightness of the black and the white is exactly the same as the grey surround on the card. This means that if you can see the outline, it will stand out against the background and you'll be able to look at the picture. If, however, your vision is too poor for you to be able to see the outline, because the brightnesses are exactly the same, the picture will simply disappear into the background and the whole card will look blank. So, if you can see the picture, you can look at it. If you can't see the picture, you can't. It's as simple as that. As we proceed through the test, the outline gets finer and finer. That is more and more difficult to see until eventually the picture is invisible. That way, the finest card that you are able to see and look at will tell us a measure of your visual acuity. In the contrast test, the principle is the same, except this time, rather than black and white, we're using dark grey and light grey, and as we proceed through the test, the picture gets more faint. Once again, ultimately, when your contrast perception isn't good enough to see the picture will look blank and you can no longer look at it. Now, on each card, we've placed the picture either at the top or the bottom of the card. Remember that we're dealing with patients that can't necessarily tell us what the picture is. But if the patient reliably looks at the picture, bottom or the top, that tells me that the patient can see it. The technique is called preferential looking because a patient will prefer to look at the picture rather than at the blank part of the card. And it's that looking response to the picture that tells us that the patient can see the picture. So all we're doing as the examiner is looking and watching the patient's eyes. Of course, those of us who are used to examining eyes will pick up the technique rather more quickly than others. But watching where people are looking is something that we're all very good at. We know when someone's looking directly at us or not. You can tell now that I'm looking directly at the camera, and now I'm looking above the camera. Back to the camera, and where am I looking now? It should be fairly obvious that I'm now looking below the camera and back to the camera. It really is as simple as that. Precise instructions for using the test are on a DVD and a written instruction manual supplied with each test. Who is it who will be carrying out such tests and therefore will be interested in the Cardiff range? Eye care practitioners, obviously, optometrists, orthoptists and ophthalmologists, but many other people will benefit from the Cardiff tests. Specialist teachers, such as the teachers of the visually impaired, always need to know a child's visual capabilities, and they need tests that young children and those with learning disabilities can perform. Teachers of children with multiple disabilities, many of whom will have eye defects that are not immediately obvious, will also like to have the capability to assess a child's vision. Health visitors and school nurses are other groups who will benefit from the tests. Many charity workers too, working with children, will also be able to use the Cardiff tests. For adults, community nurses and social workers working with people with intellectual disabilities and those with brain injury and dementia. The medical professionals working in the geriatric field, especially those with dementia, will find it useful to have the Cardiff tests for testing vision. A recent study has shown how useful the Cardiff test is for doctors working with the elderly in predicting those people at risk of falls. The tests are very simple to use, and I believe that all of the professionals that I've described can very easily learn how to use them. Each test comes with a DVD demonstrating the best way to use the test, and a newcomer after just a few practice runs will be able to measure vision reliably. Testing children. Let's consider why it is important to measure vision in young children. Young children's vision is still developing, and it's vitally important that if something is going wrong with vision, it's picked up and treated as soon as possible. Amblyopia, or lazy eye, we know responds to treatment much better when children are very young, and if the condition isn't picked up until a child is old enough to read a letter chart, it may well be too late to treat. Sometimes, of course, a child will have a condition that's not treatable, but that reduces their vision in some way. Even then, it's really important that we know as soon as possible what the child's vision is like. That way, parents, teachers and other professionals can decide how best to help the child make the most of what vision they have, to work with the child's vision rather than against it. I described the precise technique for measuring both acuity and contrast sensitivity in the DVD and in the instruction manual that comes with each of the tests. And I also give you the normal values that we expect to score in children with good sight at different ages. Although the tests are designed for preferential looking, we can also use them in other ways, for example as a naming or a signing test for older children.
It is a house! Oh.
Testing adults. Let's think about why it's important to measure vision in adults with intellectual disabilities and adults who can't communicate in the usual way. Well, of course, everyone has the same right to a good standard of eye care, whatever their abilities or disabilities. But it turns out that people with intellectual disabilities are much more likely to have eye and vision problems than are members of the general population. So someone with intellectual disabilities, for example, is much more likely to be short-sighted or long-sighted and need to wear glasses, much more likely to have other eye conditions that prevent them seeing well, such as cataracts and some of the other pathologies. People with dementia are often elderly, and of course with increasing age there is an increased risk of eye and vision problems. Cataracts, macular degeneration and glaucoma are all more common among the elderly. So people with dementia are at just as great a risk of those problems as elderly people without the condition. People who've suffered a stroke often have visual problems associated with that stroke. And some people will also have communication problems associated with the stroke and therefore be unable to take part in a conventional eye test. So it's very important for all of these people that we have ways of testing vision that doesn't rely on a normal level of communication. The adult Cardiff Acuity test uses pictures that are appropriate for adults. We don't want to patronise adults by using pictures that are clearly designed for children. And of course we want to use pictures that adults are interested in looking at. So in the adult test we use adult appropriate pictures like an aeroplane, a teacup and a coat hanger. When we developed the test, we tested a whole variety of pictures with adults with learning disabilities, and we chose the pictures that they found most easy to recognise. The construction and use of the Cardiff University adult tests are exactly the same as the children's tests, so we can use them as preferential looking. But we can also use them in other ways, whatever way is suitable for a particular patient. Here, Joanne is using sign language to sign the pictures. And Jonathan is pointing to the picture to show us where it is. That's lovely. Well done. The Cardiff University NEAR test is designed to measure visual acuity for close objects. Obviously, we all use our eyes as often for things close to us as for things further away. Children especially spend much more of their time looking at things close to them than at distant objects. As we get older, we all lose the ability to focus on close objects and our near vision drops. Adults with intellectual disabilities and people who've suffered a stroke are just as likely as the rest of us to have focusing problems. And it turns out that many children with intellectual disabilities also struggle to focus clearly for near objects, and that applies particularly to children with Down syndrome and children with cerebral palsy. So it's especially important that we have a way of measuring visual acuity for near objects in our special populations, and the Cardiff University NEAR test fulfills that role. Like the other Cardiff tests, the pictures are made up of white and black outlines on a grey background. This design makes the test particularly sensitive to poor focusing, so it should enable us to pick out which patients have a particular problem with focusing. This time we're not using preferential looking. The test is designed for naming, signing or matching, and we have a matching card along with the test. We simply ask our patient to sign, match or name each of the pictures as we go down the chart and record the smallest line of pictures that the patient can signal correctly to us. So here we have the full range of the Cardiff University tests. The acuity test, the contrast test, and the near test. And together they allow us to measure aspects of vision in children and adults who otherwise couldn't participate in an eye examination. The Cardiff tests are not a substitute for a full eye examination. So if a teacher, a doctor, a health visitor discovers poor vision in a child, we want them to recommend a full eye examination. The Cardiff test, for example, can't tell us why vision is poor or whether vision can be corrected, so a full eye examination is absolutely essential. Measuring acuity and contrast sensitivity is just part of describing vision, but it's a very important part, and the range of Cardiff tests allows us to measure vision in children and adults who otherwise couldn't be assessed. As institutions and authorities become aware of the importance of measuring vision in young children and those with intellectual disabilities, professionals are beginning to realise the importance of the range of Cardiff tests. These tests can be used routinely by a very wide range of professionals, and it's an easy and relatively inexpensive way to begin offering the standard of eye care that we all come to expect.